Welcome to the Seattle Cancer Care Alliance Proton Therapy Center, the Pacific Northwest's only facility providing advanced proton therapy for the treatment of cancer. We're here to help in any way we can, with world-class radiation oncologists, committed staff, state-of-the-art technology, patient navigators, and concierge services to help make your treatment and your stay as comfortable as possible.
Hello and welcome. I'm Dr. Ramesh Rangan, Medical Director for the SCCA Proton Therapy Center.
And I'm Dr. Jean Zhen, Associate Medical Director for the SCCA Proton Therapy Center. I also lead the prostate cancer treatment program here at our center.
In this video, we'll explain what you can expect to happen when you have your prostate cancer treated at our center.
Our center opened in 2013, and we treat several hundred patients with cancer every year. Of the patients with prostate cancer, the vast majority are cured of their cancer with excellent quality of life. Most telling, our past patients continue to remain advocates for the center as well as for proton therapy.
Prostate cancer patients at our center can take advantage of our many group activities specifically tailored to their needs. So you can be a part of a community of patients sharing similar experiences, such as at our Breakfast Buddies program and the Prostate Club, an event for men in all stages of their prostate treatment to meet and share their experiences.
Our patients also have access to integrative and naturopathic medicine programs and an array of clinical trials open at our center, so we can offer our patients the most advanced treatments available.
Thank you for watching and for entrusting us with your care.
Prior to coming to SCCA Proton Therapy Center, there are diagnostic processes patients will need to complete, including a PSA, a biopsy indicating cancer, and possibly additional scans. Your doctor will use that information when reviewing your best course of action. Before you call the center, we will need you to gather the following records for review. If you need assistance gathering this information, our medical records staff can help. Every patient treated at the center will have a consultation with a world-class radiation oncologist. They will review your medical history and discuss whether protons are appropriate for you. Your doctor may also employ additional treatment options, such as hormone therapy. You will also meet with a patient navigator who can counsel you on your insurance coverage, housing if needed, and transportation. We also offer integrative services including naturopathic medicine and nutritional services. If you and your doctor have decided on proton beam therapy, you will undergo placement of fiducial markers, tiny metal or gold objects that allow your physician to line up the proton beam to ensure that it is aimed precisely at the prostate each time. This helps to target your tumor and avoid your healthy tissue. The fiducial marker placement procedure is like a mini prostate biopsy procedure, but less invasive. Patients receiving markers and hydrogel spacer will be given medication to help alleviate discomfort. A transrectal ultrasound probe is inserted into the rectum, and the prostate is confirmed at the end of the probe. A needle containing the preloaded marker is then inserted, and the marker is injected into the prostate. A total of 3 markers are placed into the prostate. This is an outpatient procedure, and there is typically little recovery time needed. SpaceOAR, OAR stands for an organ at risk, is a temporary injectable gel that protects the rectum in men undergoing radiation therapy for prostate cancer. It is placed prior to radiation therapy through a minimally invasive outpatient procedure. Certain prostate cancer patients do not need any kind of spacer placed. Talk to your physician to determine which approach is most appropriate for you. If your doctor has decided that SpaceOAR is right for you, it will be placed during the same procedure as the fiducial markers. While the rectal ultrasound is in place, a needle is inserted between the prostate and the rectum. Fluid is used to separate the rectum and prostate. The hydrogel is injected, creating a half-inch space between the prostate and the rectum, allowing physicians to treat the prostate with much less rectum radiation injury and fewer complications. The hydrogel will stay exactly in place for 3 months and then be absorbed by your body and disappear by 6 months after the injection. Shortly after markers and space or gel placement, the patient will return to the center for a CT simulation and treatment planning scan. CT simulation is a process where radiation therapists determine the exact position patients will be in for the duration of their treatment, utilizing body positioning elements to secure the patient for the scan. Therapists will use the scan to position the patient correctly for all treatments. On the first day of treatment, all patients receive a robe, a pair of slippers, and their scan badge. A radiation therapist will take the patient back to get changed and into proper position for the treatment. Once properly positioned, therapists will leave the room, but patients are monitored for the entire duration of the procedure, and the therapist and patient can easily communicate with one another. Typical treatment time for prostate therapy is just a few minutes, although the entire treatment process may take 20 minutes. The number of treatments you have will be determined by your radiation oncologist. You will see your physician and nursing team regularly during treatment. At SCCA Proton Therapy Center, we endeavor to schedule treatment times to allow patients the ability to maintain their personal schedules. Your physician will develop a personal follow-up plan and may recommend hormone therapy depending on your individual circumstances. Follow-ups typically include a PSA check every few months with your doctor. Thanks for watching. If you have additional questions, please call us at 888-990-7782 or 206-306-2800.